lots for the volunteers.
Welcome everyone to the Ageways What's New in Medicare 2026 webinar. We're so excited to have you here. My name is Alex. I'm a communications specialist here at Ageways Nonprofit Senior Services. And with me today is Sherry Smith. She's our SHIP Outreach and Partner Manager here at Ageways. Thank you for being with us today. Today we'll be taking a deep dive into what's new for Medicare in 2026. Why you should review your plan every year, what to look for when choosing a plan, and how SHIP can help you understand plan choices and potentially save you money. So this presentation is going to be recorded, but the slides will be available at the end. You'll be muted during the presentation, but we'll have time for questions after the presentation, and you can feel free to enter them in the chat at any time. I guess we can go ahead and turn the time over to Sherry now for our presentation.
Good afternoon, everyone. As Alex said, I am the SHIP Partnership and Outreach and Partnership Development Manager here at Ageways. I've been working with this program as a manager for the past 8 years, and I'm here to present to you on Medicare. So with no further ado, I'm going to move on to Medicare 101 2025. First, I want to give you a small overview of Ageways. Ageways is a nonprofit that is your local area agency on aging. We have a variety of services and supports that help older adults and their families in our 6-county region. We serve Livingston, Macomb, Monroe, Oakland, St. Clair, and Washtenaw counties. We do not serve Wayne County, but the good news is that there are 2 area agencies in Wayne County that take care of that population. There's the Detroit Area Agency on Aging, which handles Detroit and all things east, and the Senior Alliance, which handles the remainder of Wayne County. To reach us at our information and assistance, the number is 800-852-7795, and our website is ageways.org. Some of the programs that we have that can help you are a free phone line for seniors and their families. We have a number of programs, and that if you call that number, you'll be able to get assistance to find out if you qualify for them. And really, we're the first place to call when you or a loved one need help. We have a vast number of services and referral sources for older adults and people with disabilities. And we can save you a lot of time and provide a lot of help if you give us a call first. So moving on to Medicare, which is our topic for today, do a brief overview of what Medicare is. It is health insurance for 3 groups of people: people 65 and older, people under 65 with certain disabilities, and people at any age with end-stage renal disease. It's administered by the Centers for Medicare and Medicaid Services, CMS. So when the government's open, if you get things in the mail from CMS, please don't throw them out. They're really important. And you enroll through the Social Security Administration or the Railroad Retirement Board. I've been here, as I said, for 8 years. I have met 2 people whose grandparents worked for the railroad. Other than that, of the thousands of people I've spoken to, never met anybody who worked for the railroad. When you're
my grandfather worked for the railroad, Sherry. Just there were
that's
people.
Number 3. Thank you. So when you're first eligible for Medicare, you're going to get a Welcome to Medicare packet. It's going to include a letter, a booklet called Medicare and You with the year, and a Medicare card. It's sent to people who go to SSA to sign up for Medicare. You'll get one when you first sign up, and you will also get one when you are on Medicare with less than 3 months before your disability. Pardon me, let's start over. People with disabilities who have been on Medicare, who have been on disability for 25 months will also automatically qualify for Medicare. It will generally arrive about 2 weeks after you sign up for Medicare Social Security. And if you're disabled, you'll get it 2 weeks after Social Security approves your benefits. It's a great book. We call it the Medicare Bible. It tells pretty much everything you would want to know about Medicare, and it's in a very easy to read format. So keep that book when you get it every year. So how do you enroll in Medicare? If you're not getting Social Security or railroad retiree benefits, for example, if you're still working, enrollment's not automatic. You're going to have to enroll with Social Security. You can visit the office, you can call them, or you can enroll online. I highly encourage you to enroll online. It's pretty simple. You go to ssa.gov and you click the button that says Medicare and you follow the links. I believe that they're requiring an additional ID, the ID Me or something. It's a new federal ID system. So you may have to get that first, but after you get that, it should be very easy to enroll. And if you're with the Railroad Retiree Board, you call them. After you enroll, about 2 weeks after, you're going to get a Medicare card. It's going to look like this. And it's going to have an 11-digit unique number on it. It's going to have your name and it's going to have the dates that your Part A and Part B started. The number is a unique number to you. It's not linked to anything that anybody can identify who you are by your Medicare number. That's important because prior to 2020, they were using Social Security numbers. And when those numbers would get compromised, it would create a huge headache for you, a headache for Medicare, and it's almost impossible to get a new Social Security number. The good news is, while we don't want you to lose your number, if you lose your number gets compromised in some way, you can get a new Medicare number. So this is really a good thing. If you decide that you only want Part A, that would be, for example, if you were still working and had health insurance through your employer. When you get your card, you follow the directions on the back, you sign it, you send it back to Medicare. They'll send you a new card with just Part A. And if you have questions about any of this, you can always give us a call. We'll walk you through the process. So before we go further, I want to just give you a few definitions so that, because these terms are going to come up as we go along. The premium is the amount that you pay for your insurance. It's generally a monthly premium. Sometimes it's quarterly. And that's currently $185 a month for Part B. We hear it's going up to $206.50 in 2026, but we have not heard that officially. So that's just like car insurance. You pay a premium every month. For health insurance, you pay a premium every month. Everybody pays this regardless of whether you have a Medicare Advantage plan or original Medicare, unless you're getting some kind of extra help. The deductible is the amount you pay out of pocket for your costs before your plan begins. Right now, there's a $590 deductible for Part D. Most people don't hit that deductible because their healthcare costs are lower than that. The copay is the rate or a dollar amount that you're going to pay for prescriptions. So example, or a doctor's visit. So for example, if you go to the doctor, they may charge you $10 every visit. Or you might get coinsurance that you pay after you meet your deductible, and that's a percentage. So it may be you go to the doctor and you pay 20% of the cost for your care. And Medicare, original Medicare without any kind of a supplement, and I'll get into all these different parts, is a plan with coinsurance. Medicare pays 80%, you have coinsurance of 20%. And the cost shares the amount that you pay out of pocket, including your deductibles, copays, and coinsurance, but it does not cover your premiums. So there are 4 parts of Medicare that I'll get into, each one of them as we go along. There's Part A, which is your hospital insurance. There's Part B, which is your medical insurance. Those two together are what we call original Medicare. There's Part D, which is your Medicare prescription drug coverage that people add if they go with original Medicare, they add a Part D. And there's also Part C, which is Medicare Advantage, which is an HMO or PPO, and it bundles your A, B, and D together into one plan and may come with extra benefits as well. So when you're first eligible for Medicare, you have 2 choices. You can go with original Medicare, as I mentioned, which is your Part A and Part B, your hospital and medical insurance. You can add Part D prescription drug coverage, Now, Medicare calls that optional, but it's only optional insofar as you don't want to pay a substantial penalty later on if you decide that you want it. So if you're thinking about going with original Medicare, you should add a Part D. There are Part Ds that have no monthly premium, so it's just having it in case you need it. And as I mentioned, Medicare is an 80-20 plan, so you pay 20% of the costs. So many people choose to add a Medigap or a supplement. These will help pay those out-of-pocket costs that you'd have from your original Medicare, from your A and B, that 20%. Depending on the plan that you pick, you could end up paying for your A, B, or not paying for A and B or your D, and just pay for your Medigap and your Part B medical insurance, but no other costs than that $185 and your supplement. Or you can go with Medicare Advantage, which bundles together your A, B, and D. These are HMOs and PPOs, and you usually have to use their network of providers, although many of these plans have out-of-network benefits, and most of these plans come with extra benefits as well. So going into a little bit more depth, Part A is your hospital insurance. It's your inpatient care, your skilled nursing facilities, your home health care, hospice care, and it has a deductible that is $1,676 and is estimated to go up to $1,716 in 2026. If you got a supplemental plan, if you went with original Medicare and got a supplement, you probably wouldn't have to pay that deductible. It also covers your Part B, your doctor's visits, your outpatient hospital insurance, your clinical labs, your durable medical equipment. Those are things like hospital beds or knee braces or a wheelchair. It covers preventive services. And currently there's a $257 deductible. It's estimated to go to $288 in 2026. That's a cost that everybody has to pay regardless of what plan they have. And there's currently a $185 monthly premium. It's estimated to go up to $206.50 in 2026. Please note that original Medicare does not cover vision, dental, hearing, or medications. Those are all things that you have to get a separate policy for. But Medicare does have a medication plan, which is Part D. And there you go. Part D is optional Medicare prescription drug coverage. I'll reiterate again that it's only optional insofar as you don't want to pay a penalty. It's provided by private insurance companies. You choose and join a plan. All the plans have formularies, which is a list of covered drugs. And you pay the plan a monthly premium, and you may have deductibles and co-payments. The formularies are wide. They have to cover a wide range of drugs in every category. So there are some plans, as I mentioned, that have 0 monthly premium, but they still have to cover a wide range of medications. So it's not like you get a very inexpensive plan and you may not get your drugs covered. But this is what we specialize in, is helping people choose these plans to make sure that their medications are all covered. To join a Part D plan, when you're new to Medicare, you have a 7-month initial enrollment period. That's 3 months before you turn 65, the month you turn 65, and 3 months after, unless you're still working. And if you're still working and have coverage through your employer, then you can delay enrolling in Medicare without penalty. Every year there's open enrollment, which starts October 15th and runs through December 7th. And your coverage starts January 1st. Just as an FYI, we are still booking appointments for open enrollment now. And for next year, we start booking appointments for open enrollment at the beginning of September. So mark it down and get in early. There are special enrollment periods for people at low income, people who have had an involuntary loss of their coverage, for example, if they lose their job, if you move outside of the plan's service area, and again, if you're still working. How do you join a Part D plan? You can call us at 248-262-0545. You can call the plan directly You can call 1-800-Medicare or you can visit medicare.gov. But the best way is to give us a call because we'll spend a lot of time with you making sure that you understand everything and going forward. So what are the phases of coverage? People hear things like donut hole and such like that, and there is no donut hole anymore. So initially that you're going to pay 100% of your deductible, which is $590. When you hit that $590, you're going to go to an initial coverage phase where you're going to pay 25% of the cost of the drugs, and the insurance company is going to pay 25% of the cost of the drugs. And when you hit $2,100 in 2026, it's $2,000 in 2020. This is from the Inflation Reduction Act. You will pay nothing for your medications, which is a really good thing for people, particularly who have expensive drugs. The good news is that there is a limit on how much you'll pay for your drugs. The thing to bear in mind is the drugs must be on the formulary and you must use your insurance in order for this to take effect. So if you have an expensive drug and you go to use GoodRx, for example, to purchase your medications, that does not count towards your $2,100 or the true out-of-pocket costs. So you must use the formulary drugs and you must use your insurance if you want to hit that limit. But most people that I've seen over my years here don't get close to their even their deductible unless they've got some very expensive drugs. So here's what I just spoke about, that only plans that are on your formulary count. Over-the-counter drugs don't count, and nor do prescriptions, as I said, with GoodRx. Plan premiums also don't count towards your out-of-pocket expenses. Some plans may choose also not to cover medications that are prescribed for off-label use, even if the medication's on the formulary. So something like Wegovy, for example, which is approved for diabetic care, is not approved for weight loss. So if your doctor prescribes it to you for weight loss, the plan, depending on the plan that you get, may choose not to cover it. So these are things to know as you move forward. And I know it's a lot of information, but that's why we're here to help you and to guide you through these processes individually as you go through Medicare. So one question people ask a lot is, well, if I'm not paying anything, who's picking up the bill? So we're in 2025 now with the Inflation Reduction Act. You can see the dark blue line shows that you're going to pay initially 100% of the deductible. When you hit that deductible point, you're going to pay 25% of the cost of the drugs. The Part D plan is going to pay 65%, and the drug manufacturers are going to pay 10%. And once you hit that catastrophic, that 2,100, the middle line would be that 590, then the Part D plan is going to pay 60%. The drug manufacturers are going to pay 20%, and Medicare is actually going to pay 20%. So it helps spread that cost along. This is just an interesting chart when you get a copy of it to look at and see how the cost sharing has changed over the past 3 years. So if you go through original Medicare, you get your Part A hospital, your Part B medical, and your Part B drugs. As I mentioned, it's an 80-20 plan. So you're going to probably want to get a supplemental plan to help pick up that 20%. Supplements are also called Medigaps. They're policies sold by private companies that fill in the gaps of what original Medicare doesn't cover, such as deductibles, coinsurance, and co-payments. All plans with the same letter have the same coverage. Costs are really the major difference, and not all plans are offered to people under 65 with a disability. This chart is in the Medicare and You book. If you have a copy, if you need a copy, you can ask us and we'll be happy to send you one. So as you look down the axis, it shows the different things that are covered. So Medicare Part A coinsurance and hospital costs, if you look across the top row, are covered 100% by all the plans. Medicare Part B coinsurance or copayments are covered by all the plans, but plans K and L, they're only covered at 50 and 75%. So that's your 20% that that you would pay. So for example, if you had a G plan, it would cover 100% of that 20%. It covers your first 3 pints of blood, covers hospice care, it covers skilled nursing care, covers your Part A deductible, which is at $1,600 something. And it covers your Part B excess charges for Plan G. If you got a Plan G, the excess charges mean that if you go to a doctor that doesn't take Medicare, they can charge you up to 15% more, and a G plan would cover that. The G is really what we call the Rolls Royce of Medicare plans. It does cover the most. F plans and C plans are no longer available for sale. They're still on the list because there's people who still have them, but they're older. And if you're interested in a Medigap plan, we can help give you very good estimates and phone numbers to get to the insurance companies who can help you out with that. The only difference really is a cost. So a G plan is a G plan is a G plan, an L plan is an L plan is an L plan. And just to make it more complicated, Medicare called these plans, and Part A, B, C, and D with Medicare are parts. So just to make that distinction. So Medicare Advantage plans are the other path that you can take when you're signing up for Medicare. They're health plans that are approved by Medicare. They're PPOs and HMOs run by private insurance companies. Medicare pays the plans a certain amount of money each month for each member. They include Parts A, B, and usually D. There are some plans that don't include D. Those are usually reserved for veterans who get their drugs at the VA. Most plans include some dental, vision, and hearing coverage. That coverage does vary by plan, and you may have to use the network of doctors or hospitals in the plan, but many of these plans have an out-of-network option as well. And I just want to go back for 1 minute to Medigap to mention one more thing that I didn't say. When you first sign up for a Part B plan, if you're going with original Medicare, you have what's called a guaranteed right of issue for Medigap. And that means that they have to offer you the plan at the lowest prevailing rate for the category that you're in, for the type of plan it is. They cannot do any kind of medical underwriting for you. So they cannot say, well, you had cancer or you had a heart attack or some other illness or physical issue. They have to offer you it at the prevailing rate. After that 6-month period, all bets are off, and they can underwrite you, they can charge you a lot more. And depending on what you're presenting with, they can even say that you're uninsurable. So I tell people when they're looking at Medicare for the first time to keep that in mind and consider going with an original Medicare plan. There is also an option for a look back if you get a Medicare Advantage plan to start with. You have a little bit of time to decide if you want that plan or not. And if you don't want it and want to go back to Medicare, you can go back and still get your guaranteed issue. But please talk to a counselor if you're considering that so that you don't miss deadlines. So what's new for Medicare in 2025? In 2025, I've got to update this chart. The Medicare Advantage plans must send notices mid-year to beneficiaries of unused benefits. So in 2025, in June and July, they sent out saying, you didn't use all your dental, go make an appointment. Unfortunately, for 2026, they've removed that notice. And so now it's just up to individuals to remember to use all their benefits. They're not going to get notice from the plans anymore. there's really not much else that's exactly new. But to join a Part C plan, it's the same thing as joining a Part D. You've got your 7-month initial enrollment period. You can also join or change your plan during the fall open enrollment plan. But Medicare Advantage plans also have another option for enrollment. And if you have a Medicare Advantage plan as of January 1, you also can change your plan one time between January 1 and March 31st. So essentially, you get almost a 6-month period in which to change your plan from October 15th through March 31st. So it really pays to look at your plan and give us a call and see if there's something better on the market for you. And if there's not, then it's a very short appointment and you keep your plan and you move on. But it's a shame for people to pay more money to an insurance company if they can actually keep that money in their pockets. So some things that are important to note: if you're still working after 65, even if you're taking Social Security, you do not necessarily need to enroll in Medicare. As long as you have what's called credible coverage through your employer, which would be coverage that is at least as good as what Medicare provides, then, and your HR person should know it, you do not need to enroll in Medicare and you will not get penalties. However, if you're collecting Social Security, you will be automatically enrolled in Parts A and B. Even if you're still working, most people choose to keep Part A. There are certain rules about whether you have to keep it or not in terms of who pays first. If you use your insurance between your employer's plan and Medicare. So that's something to check with your HR, or we can help out with that as well. And again, if you don't want Part B, you just sign the back of the card. This is just reiterating it. If you have qualifying health insurance through your employer, you can refuse Part B and there's no late enrollment penalties. And when you're ready to take Medicare, you'll need to have some paperwork sent to Social Security. Your HR people should be familiar with this process. If they're not, we can send them the paperwork that needs to be filled out. If that paperwork isn't filled out and sent to Social Security, you will end up with penalties. Those penalties are steep and they last for your lifetime. So it's really important to know the rules and know the timelines. So a few other things to consider if you're working past 65. Again, be aware of the dates and deadlines because there's lifelong penalties both for Part B and for Part D. If you delay enrolling, you have to get that proof of coverage. And if you get health insurance through your spouse, check with their benefits coordinator to be sure that you have credible coverage through them. And if you have insurance through your spouse and your spouse is still working and the coverage is credible, you do not need to take Medicare at that point in time. I do want to say one other word about credible coverage, and that is that it is coverage that is at least as good as what Medicare provides. But starting last year, Medicare put a cap on prescription drug coverage. And so some plans, employer plans, had caps on prescription drug coverage that might have been higher than that $2,000 or $2,100. And so what Medicare decided was that if the plan was credible in 2024, it would be considered credible in 2025. And I'm assuming it will be credible in 2026, as we've received no information that that would suggest it was different. So that's just something to bear in mind. So health savings accounts are something that impact on Medicare. Those are accounts for people with high deductible healthcare plans. The funds are not taxed to deposit or withdraw. And in order to deposit, you have to have a high deductible healthcare plan and no other insurance, including Medicare. These will be employer offered insurances. And if you're going to enroll in Medicare Parts A and B, you can't contribute pre-tax dollars to your HSA once you get your Medicare. You have to stop contributing the month your coverage begins. You can withdraw that money at any point in time to pay any of your expenses, but you can't contribute anymore. And Medicare would pay primary to the job-based coverage. If you're delaying enrolling in your A and B, and you work for a company with 20 or more employees, and you want to continue putting funds into your HSA, you can use a special enrollment period to enroll in Medicare, but you have to stop contributing to your HSA at least 6 months before you enroll in Medicare. I will tell you that we understand this, but we know just enough to be dangerous on these sorts of things. So if you have an HSA and you're considering enrolling in Medicare, we suggest that you talk with your financial planner or an accountant or somebody who can guide you a little bit better. We know the rules, but this is not our expertise. So we suggest that you talk to somebody whose expertise it is before enrolling in Medicare. If you are at a higher income, you may end up paying something called IRMA, which is your income-related adjustment amount. It affects your Part D and your Part B premiums, and it's based on 2 years prior for your tax categories. There's 6 income categories. Each one has a set dollar associated with it. So for 2025, if your income as an individual is below $106,000 or joint filers of $212,000, you're not going to pay IRMA. You're just going to pay that $185. If your income is higher than that, you can see on the chart that it just goes up all the way to where you might be paying $628.90 a month for your Medicare if your income is above $500,000 for an individual or $750,000 for a joint filer. So that's, yes?
So Sherry, this is Kathleen. Have the 2026 numbers for IRMA been released yet?
I do not believe that they've been released yet because they haven't released even what the premium's going to be.
Okay.
So
Thanks, just wanted to clarify.
Yeah, this tends to go up by just a few dollars per category each year. And there is a Part D and a Part B IRMA. I think there's a Part D slide. And this amount that they show in the last column is actually added to your plan premium. So if you have a 0 plan premium, which they have, you had made $106.01 2 years ago, you'd pay $13.70 for your Part D. What I can tell you is the IRS will find you. Don't just start paying IRMA. IRS will find you through your tax returns and will contact you through Social Security, I think, about paying IRMA. So don't worry if you fit into one of these categories, they will find you. The other thing is that these numbers are appealable because they're based on 2 years prior. So let's say 2 years ago, you sold a house and your income rose because you sold that house that year, or you sold a business. So 2 years ago, your income was higher, but now this year you've retired and your income is lower and you don't have that money from 2 years ago anymore. You can appeal your IRMA to try and get that number down. That's something we can help you with, and it's something that on all your statements that you'll get from Social Security, it will tell you how to appeal. So just something to bear in mind. There's also a lot of help for people who have limited income or resources. There's something called Extra Help, which helps pay for prescription drug coverage. There are pharmaceutical assistance programs, which you've heard those commercials. If you can't afford your prescription, AstraZeneca might be able to help you. There are those sorts of programs. They generally don't work with people who have some sort of federal health insurance, which Medicare is, but some do, and it's always worth a try, and that's something that we can assist with. We know who most of those plans are. We can research them if we can't find it, and we can help you to apply for that. There's Medicaid, which would cover all your healthcare costs. And there's the Medicare Savings Program, which is similar to Medicaid, but it only covers the health costs that Medicare covers. It would not, our Medicaid covers, it would not cover things like food stamps and things like that, but it would cover the Medicare costs. And there's different categories of the Medicare savings program. So people with slightly higher incomes may get less benefits, but there's a number of options. If you think you might qualify for a program like that, give us a call and we will do an intake and see and help you apply. There's also prescription savings cards, and those are for anybody. Those are things like the GoodRx cards, for example, that you can get at the drugstores. And those can often save you a lot of money on prescriptions. But remember, they don't count towards the maximum out-of-pocket costs that you would have for your Part D. It's really, really, really important to enroll on time. There are lifelong penalties that follow you if you miss the deadlines. So for example, Part B, if you miss the deadline to enroll in Part B, it's 10% of the standard monthly premium for each month that you should have enrolled but didn't. So this is a 2023 example. So if you should have enrolled in October of 23 and decide to enroll during the general enrollment period in January 2026, you're going to pay an additional $41.30 a month on top of the estimated $206.50 a month for your Part B premium. And as the premium changes and generally goes up every year, so will the amount you pay as a penalty. And this is for the remainder of your life. There's also a Part D late enrollment calculation, which is 1% of the Part D base premium, which is $36.78 in 2025, and it's estimated to go up to $38.99 in 2026. So for each month you don't have credible coverage and are not enrolled in Part D, you're going to pay approximately 36 cents a month times the number of months added to the monthly premium. So it can get quite pricey. And the penalty amount changes each year as the Part D base premium changes. So it's really important to know the timelines and enroll on time. And if you're not sure, all it takes is a phone call to us and we will let you know. And I will say, when I say all it takes is a phone call to us, please leave a message. We don't have as many people answering the phone lines as we have calls coming in, but we do call everybody back. So if you can leave a semi-detailed message of what you're looking for, we will get back to you with an answer. So there's also special enrollment periods that enable people to make changes in their plans. I mentioned this a little bit earlier. If you've got involuntary loss of coverage, if you're entering or residing in a long-term care facility, there's other exceptional circumstances. If you were automatically enrolled into a plan by Medicare, which occasionally happens, if a federal employee made a mistake, you have your trial period for Medicare Advantage. If you're switching to or from a PACE program, PACE is a program of all-inclusive care for the elderly, which is a really good option for older adults who need a higher level of care to get their care and be in a community environment. And if there was an issue with an employer health care plan. There's other special enrollment periods as well. If it's something that you missed a deadline and want to find out if you qualify for a special enrollment period, call us, we'll let you know. I know it sounds like a broken record, but that's the message. Please note that COBRA is not considered credible coverage for Medicare Part B. You may qualify for a Part D special enrollment period with COBRA, but not in all cases. Basically, you have to be working to have credible coverage. So when you have COBRA, you're not working, and so it does not count. There's a limited amount of time that you can be on COBRA before penalties would kick in. So I already actually mentioned the credible coverage issue. I'll just repeat it quickly, that it's coverage that's at least as good as what Medicare covers. And so if your plan was credible in 2024, it will also be credible in 2025, and I believe it will still be credible in 2026. So there are special needs plans now for people in Medicare Advantage. They're called SNPs, or special plans. They're not just for low-income people. That's something that people think that they are. There are plans for lower-income people. Those are called DSNPs, or dually enrolled Medicare Medicaid beneficiary plans. There's, excuse me, also SNPs for people with certain chronic conditions called CSNPs. There's plans for people with diabetes and heart disease, end-stage renal disease, and HIV. That's just a few of the SNPs that are available. These are PPOs and HMOs, so they're not original Medicare. You have to use the network of doctors provided, but the SNP plans often provide a higher level of care than you might get otherwise and might include other benefits. So if you have one of these chronic conditions, or you're dually eligible, you can talk to a counselor and we can look into the SNPs for you and get you more information. There's also plans for people who reside in institutions who need a higher level of care called I-SNPs for institutional. Please don't go it alone. If you're interested, it's really important that you educate yourself and talk to a counselor. It's very complicated to navigate the myriad of programs and services that are available, and there are very strict rules about applying and changing plans that need to be understood and followed. So if you apply for a SNP and are really not eligible for it, you may end up missing the enrollment period to pick a different plan, and then you're left out in the cold. So please don't go it alone. Talk to us, talk to a counselor, talk to the plan, but talk to somebody. Please note that healthcare and the marketplace are not meant to work together. When you become eligible for Medicare, you should drop your marketplace in favor of Medicare. And if you don't enroll in Medicare, you may end up losing your tax credits for the marketplace. You'll be penalized for not enrolling in Medicare if you enroll later. And if you sign up past your initial enrollment period at 65, when you're considered new to Medicare, you're going to have to provide proof of credible coverage to avoid penalties, and marketplace is not necessarily going to be considered credible coverage. Marketing guidelines. I am sure you are all inundated with mail and possibly phone calls from marketers to switch plans or join plans. Please know that they cannot solicit you door to door. That is illegal. They can't call you if you're on the national and state do not call list. It's important to update your phone number with the do not call list periodically because names and numbers do drop off. Additionally, if you've done business with a subsidiary or the parent company of whoever's calling you, they can call you. They just can't call you if you've never had any contact with their business. They can't enroll you over the phone during a solicitation call. So if somebody from insurance company X calls you to say, please join insurance company X, we think it's a great plan, and you go through everything with them and you say, yes, this is a great plan, they cannot enroll you during that phone call. You have to hang up and they have to make another appointment with you to enroll you. That gives you time to think, so you don't have to feel pressured to enroll. They can't offer you incentives or gifts exceeding $15, and they cannot offer you a meal. They can offer you some snacks, but they can't offer you a meal. My favorite is they can't engage in activities to mislead or confuse you. I'm not sure how one would determine that, but that is one of the rules. They also can't conduct sales presentations or collect enrollment information at health fairs or educational events. So if you're at a health fair and you go up to insurance company X and it looks really good, and it's a health fair, they can't collect your enrollment information at that point in time, and they can't try to sell you anything if they're there. Medicare preventive services. Medicare offers a lot of preventive services. Those are the best things to do because treatments tend to work best when you find them early. They're covered by Part B. If you have original Medicare, you pay nothing for most of your preventive services if you go to a provider who takes Medicare. You may pay a copayment or coinsurance for the visit, but not for the treatment itself or the service itself. And you may pay more from a provider who doesn't accept Medicare. If you have Medicare Advantage, it may require a copayment or coinsurance depending on the plan. And when you meet with a counselor, we go through what all the different costs are for all the different types of plans. So if you had Medicare Advantage, we would go through your plan covers all these things, and these are the costs or the range of costs for each of these services. When you're first eligible for Medicare, you get a Welcome to Medicare visit. It's a one-time visit covered within the first 12 months of enrolling in Part B. It includes a review of your medical and social history, your height, weight, and body mass, a vision test, education and counseling, and your doctor may refer you for extra screenings. To get one of these visits, you call your doctor's office and you say, I want a Welcome to Medicare visit. And they should know what that is, and they should schedule you. You also get a yearly wellness visit, which is pretty similar to your Welcome to Medicare visit, and you get that every 12 months. Please note, these are not physicals, but they are similar to physicals. Your doctor may choose to combine this visit with a physical, and then there might be some bills for certain things, but not for everything that's going on. And again, to get this, you call and say, like, my yearly wellness visit. This slide actually shows you a number of the wellness and preventive services that Medicare covers, how often you can get them, and what your costs would be. So for example, for cardiovascular disease, you can get screened every 5 years, and there's no cost for the test. However, if you go to the doctor's office for that test, you may end up paying 20% for the visit. But then again, that depends on if you have a supplement or what your Medicare Advantage plan says that you'll pay. For a mammogram every 12 months, if you're 40 years of age or older, and that's at no cost. Now, if you have breast cancer or a history of breast cancer, you may be able to have these screenings more frequently, but these are for the average person. Prostate cancer for men every 12 months. If you're over 50, there's no cost for the test, but you may again have that doctor's visit cost. All of your immunizations are free. Every single one of them is free. Your flu, your COVID, your pneumonia, your shingles, your tetanus. The caveat to that is if you go to a doctor's office, you may get charged for the doctor's visit, but you can't get charged for the immunization itself. If you go to a pharmacy, you won't pay anything for it. A couple words about fraud and scams. Fraud is and scams are $1 billion industry that are costing all of us money. It's one of the most common scams affecting seniors. Fraud scams may be if you're being billed for services you never received or equipment you never received or was returned. Recently, a group had billed over $1 billion to Medicare was busted up for billing for urinary catheters. And these were showing up on people's Medicare explanation, Medicare summary notices, but people didn't notice them because one, people don't tend to read them, and two, they weren't being charged for them. So it didn't seem like a big deal, but Medicare was getting charged. And when Medicare gets charged, we all pay, even if it's not coming directly out of our pocket, we pay in terms of higher premiums. So it's really important if you've got Medicare Advantage to read your explanation of benefits every month or every quarter. And if you've got Medicare to read your summary notices every month or quarter, make sure that the services that are on there are services that you've actually received. If something looks funny, you can call us, you can call the provider. Sometimes it's as simple as it was a typo. And sometimes there's something fishy going on and we want to be able to address that. If somebody uses false information to mislead you to joining a plan, it's fraud. One of the fraud schemes that's going on right now is that people are getting calls saying they want your Medicare number because Medicare is issuing plastic cards. Couple things to say about that is one, Medicare is not issuing plastic cards. And two, Medicare has your number, so they don't have to ask you for your number. The only time you should be asked for your number is if you're going on to Medicare.gov with us or with an insurance agent, and we need to get into your account specifically, or if you call Medicare. Other than that, there's really no reason, or your doctor's offices, but nobody on the phone should need your number. A common scam that hits older adults is when people call and they say, I'm calling from Medicare, for example, and I need to confirm your number. Is it 1, 2, 3, 4, 5? And you look at your card and you go, no, it's 6, 7, 8, 9, 10. And you aren't even thinking about it, and you've just given them your number. So be aware of that, and be aware that these callers can be very insistent on immediate action or payment, and they can be very, very scary. But know that they're not legitimate. Hang up the phone on them, especially if they ask you to pay for something in gift cards, because that's just not how it works. If anybody asks you to pay for something in gift cards, it is 99.9% chance of a scam. So just be wary. And if it looks funny, it probably is. The best thing I tell people is, first of all, don't answer the phone if you don't know who's calling. Everybody's got voicemail. You can call them back. Should you be a victim of a scam or fraud, you can call the Michigan SMP hotline. And outside of Michigan, there's a number to call as well, and there's an email address. And please don't be afraid or embarrassed to report if you've been a victim of a scam. They are very tricky, and it can happen to anybody, no matter how skilled you are. I almost got scammed recently. I was filling something out, it looked legitimate, and then I saw that they asked for my social security number. And I'm like, why do these people need my social security number? And I realized that it was fake. But it can really happen to anybody. So please just be on the lookout. And if you're not sure, you can call us too, and we can help you out with that. So how can we help you? We can help you understand your health plans for Medicare. We can help you compare and enroll in Medicare Advantage coverage. We can help you to compare and enroll in Medicare prescription drug coverage. We can help you identify and report fraud and scams. We can assist you enrolling into low-income programs. We can also assist you with appeals with IRMA or other things. If there's some billing mistake or something that you need to appeal, we can do that. We see a lot of those with ambulances that don't get the right billing codes in, so people get charged for ambulances that Medicare should pay for, and we can help with appeals for that. Basically, if there's a Medicare issue, no matter what it is, we should be your first call. If we can't help you, we will find the place that can. We're here to help if you want to speak with a counselor about your specific situation. We counsel over the phone, we counsel on Microsoft Teams, and in person we're available. Our services are confidential and unbiased. There are no questions that are too trivial, and we often deal with very complicated questions as well. We have various options for counseling across our 6-county area, and we encourage you to call. And right now, if you've got Medicare, we really encourage you to make an appointment for open enrollment. We do have space available still, and this is the one time of year that you can change your plan. And you may not want to change your plan, but you might want to know that you've got the best plan out there. So that's our information. This is me. You can contact me at our main address and our phone number. You can visit us at Medicare.gov and browse through your Medicare and You handbook, and you can call Medicare. This is an optional satisfaction survey that's part of a larger analysis of our national program. It's completely confidential and anonymous. Your participation is voluntary, and it takes less than 5 minutes to complete. If you want to fill out this link, I'll leave it up here for a moment. And
I'll also put it in the chat, Sherry.
Oh, thank you. So Kathleen's going to put it in the chat, and then I'm going to move on to our mandatory funding statement from our funders. And with that, that's our presentation, and we can switch back to the main screen and I can answer any questions people have.
Yeah, thank you so much, Sherry, for all of that great information. Like Sherry said, we're gonna go ahead and do questions now. So please put anything that you're curious about in the chat. Just a quick disclaimer though, don't share any personal health information, including diagnoses or medications, just because we want to maintain people's privacy. So with that being said, it looks like the first question we have is from Marcia. She says, last year, there were some cautions discussed about Advantage plans. Will that be true again this year?
I'm not sure exactly what you mean by cautions. We always caution people to make sure that their providers are in network, because sometimes people will look at plans and say, oh, this is a great plan, and sign up for it and realize that their doctor doesn't take it. But other than that, I don't know. Can we open Marcia's mic and get a little more clarification on what she means about cautions?
I think there were some cautions about portability, if you would live elsewhere part of the year.
Yeah.
And also, is it true that they actually kind of screen what procedures they will cover versus if you have Medicare and you have a Medicare provider, it's pretty much what the doctor would want you to have? I don't know if I'm saying that perfectly well.
Yeah, I get what you're saying. So Medicare Advantage plans are generally regional. So you have a plan and you have to get your service in that plan's area of operation. But a lot of them have out of network options. So that would allow you to get service elsewhere. And a lot of plans have big networks like Blue Cross. You could see a Blue Cross, go to a Blue Cross provider in another state. But you have to either go in network or go out of network if they allow you to do that. So that's something to bear in mind. The other thing is, because Medicare Advantage plans are capitated, meaning that the plan pays, or Medicare pays the plan a certain amount of money for each person, there is a little bit more oversight from the insurance companies on what treatments you can get. So you may have to jump through more hoops to get the treatment that your doctor wants. It doesn't mean that you won't get the treatment necessarily, but the treatment may initially get denied and you may have to do an appeal. That doesn't happen all the time, but it will happen much more often than with original Medicare, where you can see any doctor that you want to see and you don't necessarily have to have referrals for those. So it's a pro and con. There's reasons why people would take an Advantage plan, and there's reasons why people would take an original Medicare. And it really depends on people's individual circumstances, what's most important to them. You know, do you want to pay more money up front with the original Medicare and a supplement that you may not need? Or do you want to pay less money with an Advantage plan and hope that you're not going to need more expensive treatment as you go down the road? And that's why we really like to talk individually with people, so we can find out what their specific circumstances are, so we can help guide them in the proper manner.
I think I recall something also, I'm so sorry, it's been a year, that said it's easier during open enrollment to go one direction than the other. Easier to change from original to Advantage than to come back the other way. Am I misquoting you?
That's correct. It's easier to go from an original Medicare plan to a Medicare Advantage plan than vice versa. And that's because of that guaranteed right of issue for a Medigap plan, because you've only got that 6 months of time from the time you get onto Part B to get a Medicare Advantage plan with, to get a Medigap plan with no underwriting. So you can always drop that plan and go on to Medicare Advantage. But if you want to go from Medicare Advantage, like 3 years into Medicare, and go into original Medicare from Medicare Advantage, you're going to get underwritten when you try to get a supplement, and it will probably cost a lot more money.
Great clarifications. Thank you for
You're
covering
welcome.
that. I don't have any
Thank you.
dog in the fight, by the way. I don't sell insurance or anything.
Okay.
Perfect.
Next question.
I'm not seeing any other questions in the chat at the moment, but I was going to let everyone know if you do have a question and you put it in the chat, just make sure that there's a little blue button right above type message here, and make sure it's selected to everyone instead of like a particular person, just so we can all see it. And if you can't figure out the chat, you can definitely unmute yourself and ask it here as well.
So
Otherwise, I guess I was clear, crystal clear and everything, and everybody understands it.
I have a question, Jerry.
Okay.
Can you walk us through what one of our volunteer counselors or staff counselors would do during, a counseling session and how they would help people?
Sure. So we would ask you to come to the appointment with a list of your medications and a list of your providers. Then, after you sat down, we would get some demographic information from you. And then we would start talking to you about how you like to access your health care. Some people come in knowing I absolutely want an Advantage plan, or absolutely don't want an Advantage plan, for example. And if that's the case, we'll just move on to whichever kind of plan they want. If people are unsure, we'll go through an explanation and the pros and cons of the different types of plans. And then we will create a Medicare.gov account. Hopefully you have to have an email for that, but they won't email you. We just need it to get into the system. And with that, if you're already on Medicare, it will bring up all the medications that Medicare was billed for in the last year. And we'll just edit it to make sure that it's up to date. If you're new to Medicare, we'll add in all your medications. And then the plan finder that we use will show us the plans that come up with the lowest premium price and drug price. So we'll be able to see with this plan, are all your medications covered, for example? Or if they're not all covered, we would want to look for a plan where it was covered. If you're looking at a Medicare Advantage plan, we're going to want to make sure that your providers are also in network, so that that would be a plan that would work for you, because the doctors that you like to see take the plan. We'd also talk to you, which surprises people, about what pharmacies you like to shop at. The reason we do that is you can shop at any pharmacy you want. It doesn't matter. What we do is just a worksheet. But we have seen $1,000 differences between a CVS and a Walgreens. So depending on if they're in network or out of network, or preferred or not preferred. So let's say Walgreens is more expensive. I'm just as an example. You can buy your drugs for $1,000 more at Walgreens than CVS across the street, but you're going to want to know that before you walk in the door. So we look at different pharmacies and we can tell you where it's going to be least expensive to purchase your drugs. We can also look at mail order for you to see if mail order is a better option. So, we check, do you go to Florida for the winter? Because that makes a difference in what type of plan you might want to choose. So an initial counseling session takes about an hour. We get a lot of information and we provide a lot of information. And we hope that people are going to walk out of that session feeling very confident in their choices. But a lot of times people get information and it's a lot of information and they say, you know what, I want to go home and think about this. And that's not a problem. We send you home with hard copy or email copy of everything that we've discussed, including the information that comes off of the plan finder. And then people call us back a second time, sometimes a third time, to clarify before they're ready to sign up for a plan. And then we can sign you up or you can sign yourself up. It doesn't matter. But it becomes a really, once you're educated, and that's really what our main goal is, to make sure you're educated about your healthcare choices. It becomes a fairly simple an easy to understand way to move through this process. I do see a question about, are you likely to work with a volunteer? You want someone with the most knowledge possible. So let me say that both, yes, you are likely to work with a volunteer, and yes, you are going to be getting the most knowledgeable person. I say that because our volunteers have to go through 10 to 15 hours of online training initially. Then they have to sit through six half-day classroom trainings. Then they have to be mentored by a more experienced counselor until they're looking comfortable counseling. And then there are monthly trainings that are offered by a variety of places, including the state. We offer some trainings. The Centers for Medicare, Medicaid offers trainings, and our volunteers take advantage of it. This is not a stuffing envelope volunteer job. We have people who have been here 23 years, who have been volunteering 15 years. It's a really rewarding job. Our volunteers are mostly retired professionals who want to keep busy. A lot of them do taxes in the off season. And some of them honestly are my go-to people on certain issues with Medicare, because there are certain things that they know more than I do on it. So yeah, you're going to probably have a volunteer, but you can also be assured that they're going to know the information, or they will call for that. We all work as a team, and if somebody doesn't know something, we have ways to get that information from somebody else. Does
Thank
that
you.
work
That
for
was,
you, Marcia?
that was extremely helpful. I said that in the chat, but thank you so
Okay.
much.
And then I see, once you choose an Advantage plan, the only way to get medical is underwriting, even in open enrollment next year. And you meant a Medigap. Once you get a Medigap plan, I'm not sure that I understand the question, Colette. If you want to turn your mic on and clarify.
Hi.
Hi.
I meant if you sign up for an Advantage and then next year you want to go to a Medigap, you have to be underwritten and reviewed and all that, correct? Even if it's
Correct.
open. So it's kind of like
You don't need to wait for open enrollment to get, well, you kind of do, because you can get an Advantage plan anytime you want, but you'd have to wait till open enrollment to switch to original Medicare.
and even if you wait till open enrollment, you want to switch to Medicare, you still, after the first time, have to be reviewed and underwritten and answer questions, and it's more of a big deal. So your initial,
Yes.
okay.
I didn't mean to cut you off. You can continue.
No, I just meant you get that one chance basically when you're turning for your initial enrollment to make that kind of decision. So it's almost like it's better off doing that, because you can always back off and go to an Advantage if that's something you want to do.
Yeah, if it's affordable, it's often the better option. Sometimes, if you qualify for a special enrollment period, then you don't have to sign up right then and there. And I will also say that medical underwriting isn't necessarily going to jack the price up enormously. If you've got a lot of health issues, it might, or if you're a lot older, it might. But let's say you're 67 and you're healthy, and you haven't had any substantial health issues at all, your medical underwriting isn't going to be substantially different from the base price, because nothing's been wrong. So it's worth it if you're thinking about it. If you have an Advantage plan and you're thinking about going to original Medicare, you can call the supplemental companies at any point in time during the year to get a quote. There's not an open enrollment period for that.
Okay. Thank you so much.
You're welcome.
I'm
Are there
not
any
seeing
other
any-
questions?
Any more in the chat? We can give people a couple more minutes, but I was also going to say if you guys do have any questions that you think of after. I know Sherry had shared that you can absolutely call or email her at any time to ask those. So I know sometimes I don't think of something until like 30 minutes after I talk to somebody. So that's always a great option.
And I'll remind you that if you call, you probably will get voicemail. So please leave a message. You will get a call back.
Thank you. And if we went ahead and put that email in the chat. Thank you, Kathleen.
Yes, I did put Sherry's email in the chat in case you would like to get a hold of her. I'll also put our ship email in the chat as well. And I believe I was going to put the survey in there as well. So I'll go run back and get.
Thanks. And if you're looking to make an appointment, you're better off calling. If you email me, it's going to take longer to get an appointment than if you either email the ship or call the main number.
Yes, thank you. And while Kathleen is getting that survey link, I did put a link in the chat to where you will be able to access a recording of this presentation as well as the slides. As of right now, it's obviously still last year's, but I will be getting that updated shortly after this meeting. So you can absolutely watch this back or send it to someone who might not have been able to attend today.
But I've put our main number in, and so did Kathleen. And yeah, and we have not received guidance on a lot of the new numbers for 2026. Some of them we should have received by now, but with the government shutdown, we're not getting information. So the estimates that we've put out there, I think, are pretty accurate because that's what we're seeing from reputable sources bopping around on the internet. So we're assuming those are pretty darn close if they're not exact.
Thank you. I was also going to mention too that we on that link that I put in the chat where I mentioned that you can access these slides and a recording of the webinar. There's also a calendar of the list, or I guess a schedule of everywhere where we're doing the in-person enrollment counseling, and it's organized by county, which is really great. So you'll be able to see that there. As well as the locations and the times and things like that. So I'm not seeing any more questions in the chat. So I guess we will give you guys a little bit of time back, but we just wanted to thank Sherry again so much for sharing all this wisdom with us today, and those who helped run the show behind the scenes. Like I said, you can access various phone numbers and links in the chat. And if you have any questions, just reach out to us. And we hope you guys have an amazing day, and we'll hopefully talk with you guys soon.
Thank you all so much for joining us.
Thank you.
Bye-bye.